So thank you, Beth.
Go to the next question. Fred Coper, a question now for Mr. Stephen.
Mr. Stephen, AARP New Hampshire's #1 state priority is improving access to home and community-based services. Considering the prediction by New Hampshire demographers that 20% of New Hampshire's population will be over 65 by the year 2020, and the fact that home and community-based services are more cost-effective and far more popular with seniors, why is our long-term care system so out of balance in favoring institutional settings for care rather than home and community-based settings? Will you make home and community-based services a priority?
Absolutely, already have. In fact, the governor was against that movement that I tried to bring to HHS. And Doug McNutt, who was my director of Elderly Adult Services, knows we increased the number of seniors in the community more than any commissioner ever has in the history of this state. I will continue to do that. In fact, I've helped governors throughout the country move towards rebalancing long-term care. At $15,000 a year on average in the community versus $80,000 to $90,000 in a nursing home, it makes so much sense, and it's what the seniors want. But, I go back to what the governor said about repealing the LLC tax. A farmer I met this weekend in Grafton County, Governor, had paid $4,000 for his LLC small business income tax that you passed. And he got a letter from your Department of Revenue that said the tax has been repealed, but not till December 31st. He's worrying about paying his tax. He's a farmer, and he can't even create a job. And he wants to, and that LLC tax has not been repealed until January of next year. As governor, I'll make sure it never comes back.
Governor, 1 minute.
Right, as governor, I think it's important that we respect our seniors and thank them for all they've done for us. We live in a great state, and we have our seniors to thank for that. And I'm going to continue, and I will commit to continue to investing in community care, home and community-based care for our senior citizens. They deserve that. But let's look at the difference in records. John Stephen proposed Granite Care, which was a secret program that he developed working with the federal government without involving legislators here in New Hampshire or even stakeholders here in New Hampshire. Went to Washington with Craig Benson to work on Granite Care, which was a proposal that would throw 1/3 of seniors out of their nursing homes, requiring seniors to drive 95 miles to get their health care. It cut health care for pregnant women and children. And he said, I blocked that. Damn right I blocked it, and I'm glad I did block it, because that's not New Hampshire. That's not the way we operate. You asked again about how we protect services. It's a balance. You just don't cut everything across the board by 10%, which is what John Stephen wants to do. It's naive, it's simplistic, it's reckless, and it will hurt people.
Thank you. Mr. Stephen, you have 45 seconds to respond about Granite.
Sure. With regard to secret plan, I had 11 public hearings, and we moved forward on a great initiative to really robustly enhance community-based services. That's what I wanted to see in Granite Care, Governor. You stopped those efforts. I want to make sure every senior who wants to live in a home and a community in this state gets that opportunity. And you are misleading the people of this state when you say we're throwing seniors out of nursing homes. It is all about making sure we do everything we can so they don't have to go to the nursing home unless they absolutely have to. And we will help the nursing homes too as well. At the end of the day, these seniors, we owe so much to them. They have given us the opportunity to even stand up here, Governor. I will continue to move down that road. Not only does it save money, it's what our seniors want in this state, and it's what they deserve.
Fred, do you have a follow-up for this?
Yes. Do you believe that the increased state support for home and community-based services could save New Hampshire taxpayers money in the long term?
Fred, absolutely. In fact, the Democrat governor in Illinois, I helped his Taxpayer Action Committee come up with a couple $1 billion in ideas and savings, and one of them was just exactly what you had mentioned, and they're moving towards rebalancing long-term care. I've helped the folks in Connecticut do the same. New Hampshire is one of the worst states in the country in terms of institutional care and its highest cost. I saw that as commissioner. I said immediately, we need to change this dynamic. Work with our home health providers, our visiting nurses, our personal care attendants, to make sure not just in elder programs, Fred, but keep the disability community programs going as well as mental health. But we do so well as a state nationally in mental health and development disability with regard to keeping folks in a community setting. We don't do well with seniors. And that's what I'm going to fight for.
Mr. Stephen, thank you. Governor, you have a minute.
Again, I just don't think John Stephen is being straight with you. You asked him the question, you're going to spend more on home and community-based care. He has ads all over the place saying he's going to veto every single spending increase. So we can have it both ways. Now, he wants to talk about his consulting project in Rhode Island. He went down there, hired by a former fundraiser of his, as a volunteer, to help them with their Medicaid savings. Not only were there no savings generated from his help, but as a volunteer, he turned around and billed the state $500,000. They settled on $400,000, and the whole matter now is being investigated by the Attorney General. Again, he's just not being straight with how he talks about his commitment to seniors here in New Hampshire, or even the success that he claims he had in Rhode Island.
30 seconds to
Well,
respond.
Governor, you obviously have your facts mixed up. The bottom line is there was a contract. We helped the state in the first year of implementation. They saved over $100 million. Governor Kacheri, in his press release, indicated that the Lucas Group that I worked for and led efforts on the negotiation of a groundbreaking global waiver, what I wanted to do in New Hampshire, saved the state of Rhode Island over $100 million in the first year of implementation. That's the kind of leadership we're going to bring to New Hampshire. And we're going to do it, we're going to solve this budget deficit working together, and we can keep seniors in the community at the same time.